I'd like to call to order this regular city council meeting for Monday, July the 20th of 2026. I'd like to remind the audience that this meeting is being recorded and or taped. I'd like to note that all commissioners are present. We have Commissioner Myers on the phone, and we're very happy to have him on the phone with us tonight. Before we begin each meeting, we start with the invocation, followed by the Pledge of Allegiance, and tonight Commissioner Blankenship will lead us in prayer.
If you bow your head. Dear Heavenly Father, we ask that you be with us tonight and give us wisdom in our discussions to make good decisions for the good of the city. We ask that you give health to our brethren, and we ask a little special for Doug as he keeps healing. We ask this in Jesus' name. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, before we begin our business, we of course have to approve the agenda. Gina, you did say we are tabling 6.5 for until August the 26th, correct?
Correct. Danielle,
17.
oh, sorry.
Oh, 17th? Okay.
Danielle couldn't be here in person today, and just with, we thought that her logging in via Teams, we weren't able to figure out how to get it up on the screen, and so we just thought that it would be more effective to have her in person.
Nope. I concur. It's always good to have her in person. So besides tabling 6.5, is there anything else we need to add on or table or anything? Okay, with that being said, I'll make a motion that we approve the agenda for Monday, July the 20th with tabling 6.5.
Second.
Been moved and seconded that we approve the agenda while tabling 6.5. Any other discussions? All those in favor, please say aye. Aye.
Aye.
Okay, with that, we now, of course, have to approve the minutes for July the 6th of 2026. Any corrections, Bree, that we need to make a motion on, or does everything look good?
Nothing's been brought to me.
Okay, awesome. With that being said, I'd like to make a motion that we approve the minutes for July the 6th of 2026. Okay, it's been moved and seconded that we approve the minutes for Monday, July the 6th, 2026. Any other discussions? All those in favor, please say aye. Aye.
I'll abstain since I wasn't there.
Okay, passes 4-0. All right, with that now, we will now move to business, and our first order of business is the promotion of Mr. Ken Wright to Assistant Chief of Police. If you'll come forward, Mr. Wright, we will swear you in and everything. I think we'll kind of do it just right up here, right, Bree?
Yes.
Okay.
That'd be perfect. You guys wanna come up to all the way up here, sorry. Do you wanna hold the Bible for now? I'll let you do that. Okay. Please repeat after me, yes. I, Kenneth Wright, do solemnly swear
I, Kenneth Wright, do solemnly swear
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the Constitution of the State of Kansas
and the Constitution of the State of Kansas
and ordinances of the City of Pratt,
and ordinances of the City of Pratt,
and faithfully discharge the duties of Assistant Chief of Police.
and faithfully discharge the duties of Assistant Chief of Police.
So help me God.
So help me God.
Thank you so much.
Congratulations. Thank you.
All right, congratulations again, Assistant Chief Ken Wright. And then Chief Walker will, of course, be doing our next meeting, will be approving the 2 sergeants, correct?
And a corporal.
And a corporal, awesome, okay. All righty, our next order of business is probably a big one that we'll have a big discussion on. It is 6.2, consideration of a health insurance renewal. Mr. Mike Midden and Miss Brenda Johnston.
Good evening, everyone. Is this on?
Actually, those
Yeah,
will catch you
it is.
now.
Perfect. Wonderful. Once again, thank you for allowing us to be here this evening and go through and talk about the health insurance or some of the benefits all the way around. From last time, we did have some takeaways when we got together. In front of you, commissioners, you have the, actually two sets of information. The first one that has the, it says City of Pratt and has the benefit designs on the front is where we'll start. It has like in the top left, it says City of Pratt, Kansas Medical Fully Insured Renewal Effective 9/1/2026 at the top left.
And then, Mike, I'm just gonna make sure Doug has everything since he's on the phone. Doug, are you seeing that chart right now on, on your, iPad?
Page 9.
This one. Doug, did you hear me? Might be muted.
Yes,
Okay, all right, are you looking at that chart right now?
I am.
Okay, I just wanted to make sure we're all on the same page, so, sorry, Mike.
Oh, no problem, no problem. Please just stop me from rambling if you want to make sure, get clarification that Doug's in understanding and knows where we're at. This is a repeat, this first page here on page 9 of what you had already seen in the past, except for we took off one of the proposals and left. You have your current rates in the second column there, your renewal rates in the third column, and the last column was that renewal option with buying the $6,000 deductible from Blue Cross and Blue Shield. As a reminder, if you go down to the very bottom, the $5,000 deductible was a 22% increase with them, and the $6,000 was about a little under 17% renewal with them, savings of about $47,000. So one of the things that we wanted to look at I'm bringing back is that, you know, I was looking at, okay, in your first year of doing this, if you would have been on the $6,000 plan, how many people would have that impacted? Because we're looking at another $1,000 of risk to the city on the plan that we're doing. And in the first year, you would have had 10 people that it would have impacted your reimbursement plan you have in place by a little over $4,000. Okay, so we're saving 47. It would have impacted you. You'd have spent about $4,000 more in that first year. So that's a no-brainer, right? This year so far, we've had a lot more claims this year. You would have had 15 people so far. We still have a couple of months of claims here for a total of about $11,000 that it would have impacted so far this year. I imagine it would be a little bit higher than that, but still with the $47,000 in savings to go to the $6,000 plan, no matter what, that is the recommendation that we will provide, that I'm providing to you, is say, hey, let's look at that renewal option 1 with the $6,000, and those would be the figures then that would be our umbrella policy that we buy from Blue Cross and Blue Shield. Any questions on that? Okay, if you flip then to page 10, this would be and I'm thinking that this says proposed medical plan design, and there's a lot of information on this page, just some key things that, this one?
Yeah, I got it.
Okay, all right, perfect. This would have came with your packet. What you got today, we'll go through here in just a minute because we had some changes that we brought today. Really on this, if you look at the section that you look at where it says $6,000 right in the top, right there in the black area that's on that is your we call it the liability threshold, or that's the plan you're buying from Blue Cross and Blue Shield. So underneath that is where you give better benefits to your employees. And with that increase to the $6,000, we talked about the last meeting of, okay, where the deductibles and co-insurance were set. The recommendation would be that instead of we're going up $1,000, and then if you go down, you see what the employee deductible would be is $1,000. And that, once you took that $1,000 off the $6,000 deductible from Blue Cross, that leaves $5,000 total. And then that $5,000 total, split 80-20, would be $4,000 that would be paid by the reimbursement account that we're funding and that you guys have been funding the last couple of years. and then the employees would have 20% of that, or 1,000. So if you add those two together for the employees, it becomes 2,000 instead of the 1,400 that's in place right now. Okay, so that would be an increase from 1,400 to 2,000, and then the HRA right now is $3,600 for that reimbursement account. Your maximum that the city's liability would go from 3,600 to that 4,000. So that's really and then leaving everything else that's been running exactly the same. The co-pays for the employees on prescriptions and doctor visits and all that, leaving the same. It would just be that one. Looking at that impact, it would impact the employees for this year by about that same amount that we talked about. So there'd be about $4,000 more that the employees 2 years ago that they would have paid collectively, not each individually, but the entire group would have been about $4,000 more. And then this year so far, it'd be close to that 10,000. They would be covering a good chunk of that, of those dollars as well. Okay? Any questions on that? That make sense?
Doug, did you have any questions?
No, I don't. No, thank you for explaining that.
You bet. Okay, so then if we go to the next page and what was sent to you on your iPad, is actually the exact same page that you have on what was handed out, the first page that was handed out to you today. So this in page 11 on your iPad, or now this one on page 11 is a little bit nicer to look at than the one that we put together today. So my apologies for that. But so if you look at this, there's really 4 sections to this. You have the top section, which is your current $5,000 Blue Cross and Blue Shield high deductible with a $500 Freedom Plan deductible. That's the first section, and you can see right now the fixed cost for the administration of the plans of $27. Then you can see what's being set aside for reserves. You can see what umbrella is what's being paid to Blue Cross and Blue Shield right now. So the total medical premium right now is in that column from $597 to a single to almost $1,900 as a family. The current dental rates, you can see those on there depending on which tier an employee is on, from employee only to family. And then you can see a total medical and dental premium if you combine those two together. Right now they are combined, is how things are ran through here. Employer is paying the full 100% of that $629 on employee only, and employees have 0. And then you can go down through, you can see last time we talked it was 90%. Well, you can see when we look at these, it's actually on the employee spouse, it's a employer's paying about 89.74% up to employee child. The employer's paying 90.19. I think last year when we just left the rates alone, that created just a little bit of that gap, that percentage gap in there from the previous year. And so you can see then, as you go across here, you can see then what the employee contributes of each one and how much from a dollar perspective per month the employee contributes. That's the current, okay? The second column would be your renewal with the $6,000 deductible from Blue Cross and Blue Shield and moving to a $1,000 deductible with Freedom claims on the Freedom Plan. That's what we just talked about on that page before. You can see you still have the same fixed cost. The reserves are going up slightly. The umbrella policy, that's with Blue Cross is what's going up, that 16.8%. So you can see the total medical premium, and you can see that percent increase is about 12.78, 12.71, depending on which tier it is. And then when you add in the dental increase, which we just had a slight increase on the dental of less than $1 on single, a little bit more than $2 on a family, you can see what your total is. And then if we just moved forward with that plan right there, and we just made sure that everybody was at the 90%, you can see that what the employer contribution is on each one of those. you can see what the employee contribution is. And that says 10.25, that should be 10%. That should be, all three of those should be 10% in there. I don't know why that says 10.25, if you're looking at that. Then you can see what the employee's contribution is, $151 for an employee spouse on 42, and then the percent, or the dollar amount increase, you can see in the right-hand column. Okay? The third one, we were asked then, well, what if instead of 90%, we looked at 85% on here? The third column then, just to, everything else stays the same throughout it. You go to the far right-hand side of that third set of numbers, you can see that that would increase the employee contributions, and you can see the total increase of about $89 for the employee spouse, right at $89 for employee child, and about $112 on the family to make that change. Okay, so that would move to the $6,000 deductible with Blue Cross and Blue Shield to get that savings. But then when you, and that's still looking at, because of the increase from current, if you wanted to go, that would increase the out-of-pockets a little bit for the employees and for your health plan, the health plan part that we're saving, the savings account. And then you can see what the increase is on the right. The very bottom kind of broke this out by month, what the employees pay and what the employer pays. In the bottom left, you can see what the total monthly is right now. For the 85 employees on the plan is about $96,000. The employees monthly is $8,315. With the renewal right in the middle section of the bottom, you can see that that increase is to about $108,000 for the employer, about right at total $1,000 to $9,300 for the employees. On that is if we left everything basically the same at that 90%, with the city paying 90% of medical and dental. And then the far right then you can see what the, in the middle at the very bottom, under that renewal, you can see what the increased dollars is, about $142,000 for the city and about $12,000 for the employees, based off the enrollments. On the far right-hand side, if you move to the 85%, then you can see that that shifts the dollars. It's about $86,000 to the city and about little under $69,000 for the employees. So that gives you, from one of our takeaways, was going from 90 to 85. Any questions on that? Okay. So what was handed to you today, again, page 1 is just what we went through. Page 2 of that, there's just some other options to consider after some discussions. The first one is, and you can read at the very top here, this would be comparing 90% to going to 75% employer for the dependent contribution. The top section is exactly the same as it had been on the previous page. The employee contributions on the right, that's your current. The second section there is the renewal. That's what we just looked at. And you can see what that would be from a, excuse me one second here. On the 90%. Then if you go to the third, this would be the option. This is the 6,000, and this is moving the cost share to 75% on this one. In the third section there, you go to the far right-hand side, you can see that from the employer contribution as well as the employee contribution at 75-25 for the dependents on this. And that's still taking in consideration putting medical and dental completely together. You can see what the increase to the employee in the far right of that $240 for employee spouse and $335 for the family. Any questions on that? Go right below that, you can see that by doing that, what the increase or decrease is to the two different perspectives, to the city. In the bottom right-hand corner, you can see that is actually a decrease in dollars by 25,000 to what you're currently doing, but an increase of about a 179 out of payroll deduction would be the 75. Okay?
Doug, you have any questions so far?
No, I do not, thank you.
So I'd say that one goes too far. It's not.
Yeah, I can concur with you that that is not an option.
It's a pretty big jump.
Yeah.
Pretty big jump. Then the next page, changed it up just a little bit. We had talked about, from the medical and the dental side of things is like, okay, can we separate those two from one another? Right? And so this one here, if you look at the top, you can see moving dental to 100% employee pay on their dependent and 80% employer dependent contribution on the medical, and still covering the employee's dental on this. So just to explain this top one is what you currently would have. The second one is the renewal. So on that one there, I'm gonna work left to right again on that second one. So on that $6,000 deductible, you have the fixed costs, the reserves, the umbrella for your total premium. Still have the same percent increases that we're looking at between 12 and 13%. And you can see this is medical only on this. If the city paid 100% and then paid 80% of the dependents, you can see what the employer contribution would be in the next column. And then you can see the employee contribution. And again, you can tell this was put together in a hurry today. So that where it says employee contribution, those instead of 10, if you want to write down, those should be 20%. It is 20% correct in the, let me make sure here. Yeah, it's 20% in that employee contribution in the dollars, the 289 and the 427. So you can see what theirs would be, and you can see then in the next one, 100% employee paid on the dental rates. And then if we go over to the right, then you can see what the total employer contributions would be.
So Mike, actually there, the employee contribution is, the 289 is 80% of the total rather than.
Yes. It's 80% of the total medical premium column. Okay, if you look at over the back at the total.
Okay, I was, with what we have in parentheses in the description, employer cost share at 80% and dependents paying 100% of dependent dental. So, okay, I see what you're
Yeah.
doing.
So if you look at where it says employee contribution dollars, you can see that those are medical. And so there's like 0 for the single employee, the city's still paying 100% of that. And you can see for the 20% that the employee would pay of the medical rates is 289. And then this is saying, hey, the employees, if you want the dental, you're paying 100% of the dental. And then you can see with that, the $32, then the employee would then start covering the dental, and then they would cover like the 69, the 64, and the 101. So again, you're looking at some pretty significant increase on that for the total employee contribution on the far right, anywhere from a single is going from 0 to $32, and the family would be going from $200 and some to from $198 to, I'm looking at the wrong one. Yeah, the employee's current is about $199 is what the employee is currently paying, and that would be going up to $529.
Like, that's a monthly rate,
That's a
correct?
monthly rate, yes.
So can I just talk to the commission about. I spoke to department heads at the department head meeting today, and there is an understanding, that the commission would like to perhaps have some more buy-in from the employees regarding the employee spouse, employee child, employee family. But some of the numbers we're looking at are untenable for our employees right now. If you're going to ask more of them, it needs to be in a tiered way, so I agree with Monty, 75% goes way too far. When I look at and I don't agree with taking dental insurance away from the family members. Asking for buy-in is one thing, taking away all contributions from the employer, I think that also goes too far. When I look at the comparisons that were in the packet, when you look at the 85, the renewal 85% employer, that still increases the bottom line in the bottom corner of this chart. That still increases the employee's contribution by almost 68%. And so the dollars might not be as much as maybe the percentage is still a little higher than some employers pay for their employees' dependents. However, that brings the city's increase down into the single digits, and the employees are contributing quite a bit more. And then if you want to look at perhaps lowering the city's renewal next year to 80%, I think that's a reasonable tiered way. But anyway, just from my conversations with the department heads, and they may have some input too, if you want to hear it. But that's just, my suggestion would be to go with the number that was in the packet and the 85% contribution by the city, without taking away the dental, after talking to employees today.
So background on that, my thinking on it is the way we have it structured, I think could be better. And my thinking is on the dental, we're paying for it whether or not employees use it. I don't know to what extent employees use it. When I analyzed ours at the bank, when we got dental, we pay for it all ourselves. You have to get a cleaning every 6 months to break even on it. And by doing that, then you're, in essence, for free insured for cavities or some of the other stuff that it covers. So if an employee is not getting a cleaning, assuming yours is the same, ours is Blue Cross, I don't remember our premium off the top of my head. If an employee is not getting a cleaning every 6 months, there's money being spent on premium that it's not being received on benefits. And so that would leave it to the employee to make that decision. My thinking was, instead of putting that money toward dental, put it toward medical, which I consider a higher priority than dental, so that it makes an employee who's pinched and has to choose easier to get medical, and potentially they don't use dental enough to justify it. That's my reasoning for putting the dollars toward medical instead of putting them toward dental. And if the employee uses it, well then, go ahead and pay for the dental.
Do we know how many of our employees, have used the dental? You
I
have.
do, but my mom works at a dentist office.
Okay. But do we usually see almost, 85 employees that we have?
So we see usage on the medical, but we don't see usage on the
We get
dental side.
very little information from Blue Cross on that.
So Brianna had a good point earlier today where she said we're crunching numbers when we have a month until our plan renews. And so that feels very stressful for us to be talking about it right now. Whereas if we could have a way to break out, to have options, what did Deb call it? And, if you have levels that you can,
Yeah, the high deductible, the low deductible, like if the employees themselves would make some selections and that would impact how much they're paying rather than the city, reducing the spend and raising the costs without giving options. Because if somebody's a healthy young person, they may not care to have a high deductible plan if it costs them less on a monthly basis. But myself, an aging family with young children that are active, that's very important to me. So I want a low deductible, so I'm more inclined to spend the monthly premium costs.
and then we could have the option of having dental or not if we were given those options and a family could opt out of it, but we wouldn't be taking all of the employer's contribution away from it.
So, Mike, is it business as usual for cities to pick up the tab for single employees on medical all the time?
From a benchmark standpoint, yes. I would say that most cities, similar cities in this area are still covering 100% of the employees, at least their medical side of things.
Yes.
Single.
And
For
Single.
single, right? Now, there are still some in this area that are picking up 100% of everything.
Yeah.
They're not as big as you all. They're smaller cities that are still doing that. But, and there's some of them that have recently changed from doing that, from 100% of family coverage as well, just because the costs have continued to go up. And some people are going on, when you do, that's a whole, you're not doing that right now, but covering 90% of it right now, that like you do, probably in some instances is covering higher than what an employee could get if a spouse is somewhere else, right? The coverage that they could get somewhere else.
yes.
And so,
Now, I will share this. Unfortunately, I don't have the information. We participated in a survey through the League of Kansas Municipalities where they took all of our salary information. We do this on a regular basis. But the information when it comes back is very convoluted because they have all the cities listed and then there's data all over the place. So I actually have that in front of me, but it is not in a shareable format currently because I'm talking, if I was to print it, it'd be like
Columns and
4,000 pages of column after column and row after row. But like if I do a quick scan, Parsons is paying 100% of employees, Abilene is paying 77% of employees, 92, 100, 90, employee only, 100, 91, 85, 100, 94, 100, 80, 100, 95, 85. I think as far as municipalities, they're covering benefits. One of the difficulties with that is a corporation might say, well, we don't give our employees that type of benefit. But one of the challenges we have with keeping linemen is they can make a significant higher paycheck at a competitor that's a corporation and they don't care about the benefits, they care about the income, so they go over there. But we also have people like myself. I moved here from Wichita. I took a slight pay decrease, but the deciding factor on my interest in this position was the benefits. That is what drew Brianna Garten to the city of Pratt. And I mean, in the 3 years I've been here, I've made a significant impact on our savings and things like that. So I don't know, I think we tread lightly because this is a topic that's gonna impact a significant amount of people.
We had the option when I was with the county to purchase, we could pay more if we wanted the better plan. To where like this is the cheapest option. And then if you want the lower deductibles, because I have a young family too, so I was willing to pay more per month because I wanted the better plan, or the more expensive plan. And so that was kind of a thing that they did, is like you can either have bare bones and pay the least amount, or you can buy the employee can pay more per month for the better package too, so.
So one factor I think is highly important is the way we have it now. If we went with this 90% plan, that you have two employees that are equal pay, equal quality of work, et cetera. One is single, one is a family. The one with the family costs us $6.91 an hour more to employ them than the other person. And I am more of that is a hidden cost. You know, if the employee pays more of the health insurance and you pay a higher wage, then there's more of a balance there. But on a lot of people, that is a significantly higher cost for the one with the family that we are paying and probably ignoring the fact that there's that difference.
And so money, that makes sense, and we did talk about those numbers today. I'm just asking that we not swing that shift all in one year, you know, that
I agree.
and that it's a discussion, like Bree said, every year where we can look at the impact on our employees and see what, you know, doing exit interviews and was health insurance and benefit packages a deciding factor in some of them in leaving, so that we can have that information.
But we have to decide what direction we're going, if we're going to incrementally move that direction. Whereas if we just keep doing the same thing, we're not moving that direction.
Which is why I think if we take that third plan with 85%, we don't go to 75%, we don't take away dental, but if we go to that 85%, that's a 5% decrease in the total premium that the city would be paying. So the employees are picking up a little bit more of those extra fees. And it's about $100 more, $111 more a month for a family plan, which is, you know, $55 more a paycheck, which is a lot for some of our employees, but it's not $300 more a month.
Doug, do you have any comments or questions right now?
No, I don't. I don't have any comments. Thanks.
Uh-huh.
I don't know if I can.
Oh, we record up there.
Oh, there's the mics.
Oh, great. I love that, actually. So I don't know if it's helpful or not, but I'm kind of the only man, I guess, sitting in the middle here because I'm not on the commission and I'm not an employee, right? And I have an extensive amount of governmental background. I'm doing this right now with 2 other counties, right? And when you're looking at benefits in terms of what it means for a family versus employees, on average, if you look elsewhere, the private versus the public employer, there's usually a difference in pay, okay? And that pay has traditionally been something that's made up for with benefits. Now, the transaction that is kind of unstated is that cost is coming out of control, right?
Out of what?
It's almost out of control at this point.
Insurance premiums.
Okay, the insurance premiums, and so you're moving the transition where everyone's moving. Every single government that I'm working with is moving into this transition at this time, okay? Unless they have a legacy plan that's never been touched since before the Affordable Care Act. And so if you have one of those, then sometimes you just don't even look at it because you can't ever get one of those again, okay? But the reality is that if you have a legacy plan or even with the raise in cost, that's where everyone's going. The balance is you're paying a little bit less, and so you've been subsidizing that with insurance costs on the per hour. So that it has been an important component. But there's one balancing factor that goes in that we look at, and I don't know the age of the workforce, it's not really my business, okay? But what we're looking at elsewhere is you have what are traditionally high demand users as we get older, right? And there's options if you are moving from a period of time where you're fully subsidized on a city plan or you're looking at Medicare, okay? And so if you have a cost that doesn't go on ahead and factor in the idea that, hey, as an employee, I have an option that requires me to participate in a Part D plan as well as a Part B plan, and there's costs with that, where the employee's not weighing that and sharing in some of that, then you have a higher faction of people that may or may not be eligible for participation in like Medicare that are staying on your plan, and that drives up your monthly premium. So I don't know if that's the case here or not, I'm not saying that is, but I'm saying that's one thing. But the balance that you're going through right now, which is still providing coverage for families at some level and subsidizing that on the hourly rate, is the same thing that's happening across the state elsewhere.
And so Austin does bring up a good point. There was an employee who did move to a Medicare plan, and they'd been eligible to for years before. Brenda helped them with that. And I would say the majority of our employees are not above 60. I would say most of them are under 60. And so that doesn't happen often, but it
65.
right, but I'm looking at just across, like, even the oldest guy here is still in his 50s, so.
A lot of finger pointing.
Yeah.
Looking at that side of the room.
You guys aren't 60 either. I don't know, maybe. Are you? Are you? Okay,
Yeah, we are.
forgive me. I'm sorry. I didn't mean to point you out. I meant to point him out.
But that's
Yeah.
other than that, if you're touching on this, everything you're wrestling with is reasonable.
Yeah.
And the exact same, that's the reason I spoke up, is because you're dealing with something that's complex. You know, you have commission, you have employees, you have a lot of different things that are coming into it. There's no perfect answer to this. Anywhere that you come out, you're still subsidizing at a level, but traditionally that's been a subsidization because you're not paying at the same rate that you would on the private side to keep people in.
I think Bree brought up a good point, though. I would say from a benchmark standpoint that most employers, including municipalities and on the private side, offer more than one plan to their employees. And the reason for that is exactly what we talked about, is that people are in different, it was kind of mentioned in this, they're in different spots in their life. You know, some would rather have that $5,000 deductible, just have catastrophic. If it happens, I'm healthy. If it happens, then, you know, I can buy an accident, not for an accident plan.
Yeah.
Yeah, there's I can have an accident plan in case I have an accident, you know, type of thing, you know, use some premium on that. But I would say, as Monty mentioned, is if you're moving in that direction and you went to the 85 this year, it would be, I would say the next step is looking at, you know, can we offer two plans, one at a cheaper rate that if someone wants to go to a higher deductible. And I mean, is it feasible this year? It's feasible. I mean, it kind of puts the crunch on things right at this moment, but that would be a good progression as well in the future. To do that.
Justin, you were talking about the options.
Yes,
Were there only two options?
if I
higher and a
recall
lower?
correctly, that they were going through that whole situation of how do they save money with the, you know, the insurance costs so much. And so they basically said, hey, you can pay X number of dollars more to keep the plan how it is this year, or you can keep your contributions the same, but your plan's gonna be a higher deductible plan. And they could have changed that by now. That was a couple years ago, but I do remember having to pay a little bit more every month to keep my plan with the premium or the out-of-pocket expenses the same.
I don't mean to point him out, but Terry, do you get your insurance through the county? Your health insurance, is that done through the county?
I don't currently have health insurance, so no, we don't. I'm not a full-time county employee.
I thought that you were, I'm sorry.
Yeah.
I thought that you could help, inform us on what the plan options were. Okay.
I think a solution like that would accommodate, the staff that we're trying to attract, that experienced and that are really gonna benefit our program, and then the people that we're gonna train to become those people, like our
Correct.
younger folks that are coming in, because we need to have options for both, because we're not employing just folks in my position. I hate to say this, but I am willing to contribute more because I know the community is asking, things of us with our budget. So we're willing to contribute, but I don't want to swing the pendulum too much because that's what drew me here. And I don't want anybody to be in a position where they don't think this is beneficial or the right place for them anymore. That's my 2 cents.
But as having some of the lowest paid staff in the city, the ones that are going to, if we look at a tiered system, be able to make ends meet, even on the lowest scale, are gonna have to automatically take the bottom rung insurance package, just to put food on the table or gas in the tank.
And then your bills stack up, which you can't
Correct.
pay, which puts you in a bad position and yada, yada,
The
yada.
the staff that is obviously right on the cusp of whether or not they wanna stay with the city, this will be a hinge. They will either move to greener pastures or suffer for it. I'm not saying there's a good answer, but I mean, $18 an hour and $111 increase, that's a pretty significant portion of a monthly income. And if it came down to a split out dental plan of whether or not they want dental, they're gonna guarantee they're gonna buy groceries before they go to the dentist. And if they got a family, that's just the whole family gonna have to deal with it. I'm not saying there's a right solution, I'm just looking at it from the low income side of the city staff that unfortunately is under me.
It exists.
Well, I've heard it said on that topic that you can't pay bills with benefits.
Agreed.
You can't buy groceries with benefits.
Right.
So,
They'll let the benefits lapse to buy the groceries.
and so.
That's one of the biggest draws for the city, starting out, is the benefits. I'm not saying $111.97 isn't doable, but for $18 an hour, that's gonna pinch.
Also, if you don't have the benefits and you have to go to the doctor or the dentist, it's gonna cost you a lot of money.
Correct. And we're not looking at just $111.97 on that policy. You're also looking at increasing the deductible on top of that also.
Which
So-
2 years ago, that's still well below where it was 2 years ago, but it is an increase.
Yeah,
It
I
is
was
an
here then
increase.
too, and I 100% agree, but one broken leg just cost you another $1,000 a year. So,
600, I
Well-
think 600, yeah, on this plan,
on this plan.
on the renewal plan that we were talking about, yeah. But it is a lot.
You know, the school district that I work for, we're in this battle too, and we're contemplating on re-looking at health insurance and everything. It's too late for us to reevaluate and everything like that, because we'd have to start looking at it in October anyway, but kind of looking at everything, and it's hard. It really is, because you want to make sure that, employees are taken care of to everything else and all that. The way I'm looking at it, I kind of agree with Bree, is maybe give them options, but at the same time, I feel like we can't just cut it too quick in my opinion, I'd go with the 90%, but that's me. But if this commission wants to go a different route, I'll be more than happy to go with them and stuff, but I know that 75, in my opinion, is out, and also taking dental away, that is out
Correct.
for me. I'm not gonna vote for that,
Yeah.
so.
I won't either.
I agree with you, Kyle, on that.
So I guess our biggest question is, do we do 80, so Doug, were you in agreement on just not cutting dental or the 90% or?
Well, I don't like the idea of cutting dental, but, I like what you just said. I mean, I think the city's gonna have to pay more. I don't know how. But we've gotta keep our employees, we've gotta keep turnover down. We can't, it would be nice to do what Regina talked about on tiering, but costs are just out of control, and, I don't wanna put too much burden on the employee.
So are you talking the 90%, Doug?
Yes. But I really don't want to do away with that dental option. Everything everybody said was true. And, you put food on the table before you put dental. But some kind of catastrophic dental can really break a family, and especially if they have children.
I don't know that dental actually covers that much. You said catastrophic dental?
Well, if they had some trauma to their face, their teeth, and a lot of, I'm not a dentist, but a lot of diseases and illnesses start with dental
That would go to
problems.
medical.
I was just thinking, when I looked at our dental, it had a pretty low ceiling of what it covered.
It covers 50% of crowns. It doesn't cover ortho, but it does cover 50% of crowns and
Those
70.
cavities.
80-20 on fillings and
That's substantial.
Yeah, it is.
80-20 is great.
And then 2 cleanings a year.
Yeah.
And I'm assuming sealants are covered at 90%.
Jeanette, I know you've been kind of quiet and stuff. I didn't know what your thoughts were
I'm agreeing with you and Doug and
on the 90% in keeping dental.
But so with what you're saying, if we keep the 90%, with all the insurance went up, a family monthly premium would only go up $25.
A month or
A month.
paycheck? A month?
It's better than
That's-
111.
And I understand where you're coming from, Monty, but just looking at this, I'm looking at what Jeff said, the low end of our employees as well. 111, that's a lot of money for them.
And we do have some employees that don't even make $18 an hour.
Oh, agreed, yeah,
Some of them only make 16
full-time employees.
full time. Don't make what?
They,
16.
18, they don't make 18,
Okay.
they make 16.
I mean, we harp on, we gotta watch the budget, we gotta watch every dollar, yada, yada. And then to say with a straight face, we're only gonna raise the employee share $25 a month. That's inconsistent, in my opinion. I mean, on the top end would be the 85%. With that, and the city's share going up 7.44, I think we can stand more than that, but with the 90%, our share goes up 142,000 and the employee share goes up 12,000. That's us shouldering too much of that increase.
What's the deadline on a decision for this?
Do you renew August 1st
We renew September 1st,
until September 1st?
but we do have to have enrollment sessions where Brenda picks 3 days or 3 timeframes where employees come in.
We have looked at August 12th and 13th and the 18th.
Not at a postponing this again, but I'd like to pull the staff. I mean, you know, if 80% of them don't care about a $111 increase to keep their benefits exactly the way they are with a little bit of a deductible increase, I'm fine with that. I can suffer 20%,
Well,
but
can I also say, about 25 employees are employee-only coverage, and about 26 employees have a family plan. Is that right?
Well, we have, the last numbers I had was 35 employee only, and then 25 families, and then the other 16 with spouses and 9 with children only. Employee children.
So
So
yeah,
about 50 of your 85 people right now have a dependent on the plan.
So on causing people to leave, on a family, where are they gonna go to that the family plan only costs them $335 a month?
It's not the benefit that we're competing against, it's the gross or the hourly pay that's more competitive. Like that's been one of the challenges that you've talked about at the Line Barn. I personally, 2 of my staff members today, one of them specifically said she chose this position because of the benefits, just like I verbalized earlier. And then my other staff member said she's making $8 an hour less than her previous job that she had at another city, but still. So I think benefits are, if we continue to reduce benefits, then we need to increase income, which is not accomplishing the goal that we're trying to accomplish here.
And one problem I see that we have is pay raises come at the first of the year. This comes mid-year.
correct.
So you give a pay raise, employee gets used to the extra disposable income, then we raise this and it sucks it back down.
I thought that was a good point that you brought up, yeah.
I don't know how hard it is to shift a
Yeah,
plan
so we're down.
to the first of the year.
How hard it is. It's a trick question. So because of how your deductibles run, which start over September first every year, you can find, like Blue Cross would give you a new renewal, if you wanna switch to a January 1 effective date, but deductibles and stuff would start over again, January 1. They're not gonna give you the same deductibles for, the last 4 months of the year and then carry those on for the whole next year where you have your next renewal as 1/1 of 28, that would be. So there's always gonna be, if people have made those changes to a January 1, but it's difficult to, I would venture to say it's probably gonna be easier to go the other direction and decide on pay raises in September versus trying to switch the benefits to January 1. Does that make sense?
Or there would be, the employee contribution is going to change in January. So basically, between now and then, the city would stand that difference and have it effective January 1st.
Which becomes a qualifying event, which then would lead to not necessarily a full open enrollment, but because anytime you switch what the premiums are at that
Okay.
time, it would then, you'd have open enrollment this month, and then anybody that would want, because you're substantially changing, the word substantial is used in the regs, so defining substantial, who knows what that really is. But with the change going from 25 to 112, I would figure that most reasonable person would say that's substantial. And so there'd have to be basically the opportunity then in December for January 1 for people to change their enrollment. So you'd have to do another enrollment each year if you didn't.
So I think
That
that
doesn't work.
for the public, this is a good educational moment where people scream, well, just cut spending, cut spending, cut spending. Okay, we cut the spending of our health insurance, then our employees are either gonna have fewer benefits, pay more in deductibles, pay more in premiums, and still our insurance went up a substantial amount from last year. So the public needs to understand cutting spending isn't easy or even feasible at times. We have no option with health insurance right now. Either the employees are gonna pay more or the city's gonna pay substantially more.
One of the good thing, and I wanna put when you guys made the decision to go to the HRA, right now, you'd be looking at over a 20% increase to whatever you were paying before from Blue Cross, right? And now if you look in that middle column, you can see based off of having the HRA is that in how the funding is set up, we're looking at a 12 or a 13% increase, which again, I know that's a lot. But instead of looking at a 22, 24% increase, we're looking at a 12 to 13% increase. Plus then you get to save any dollars into that pool that you have right now, that you've been saving into. So that's a positive. So you have, when you talk about transition over the last 2 years, that transition has been there. I think and from my opinion, I do think that in the future, the next, whatever you decide tonight, if you go with the 90 and you stay with the one plan for this year, that next year we work on, okay, what is that second cheaper plan gonna be? So then you can look at, okay, just like Justin just said a minute ago, if you wanna keep your plan, this is what the rates are gonna go to for that plan, to keep it. But if you wanna go to one of these other deductible plans, here's our options. Option or options might be a feasible, as you talk about steps anyways, just throwing that out.
So one other thing to consider, as far as my $6.91 example, what I proposed, and it got missed in my communication to them, is that we pay the employer or the employee share $6.73 on everybody, and the employee pays a given percentage of the cost above that. So on a family, the premium is $2,137. So we would pay the
Which
first,
one do you talk about, Lonnie?
on the first page, the second group.
I don't have that.
It is the 85 that he was talking about, 2,100, yeah.
So the total medical premium with the $6,000 deductible is $2,137. And so we would pay the first $674 of it, which is what we pay for all employees. And the amount above that, the employee pays a percentage of that, rather than the employee pays a percentage of the whole thing. Which that would differentiate more for the family plan versus the employee spouse or employee child. It sounds like I'm picking on families, but for what it's costing us, the employee's share is really small.
So this would increase $1.99 per. What do you,
Well, I don't have it worked out, what it would be. I tried too late in the day and had an error in my calculations and thought,
okay,
you can't do it manually and not make mistakes when you're trying to hurry.
Well, when I first started working here, 20-some years ago, I was paying $25 a paycheck for my single policy. So I don't know if we want to implement that again. I would definitely pay it just to keep my benefits from decreasing.
Well, that was my question. You know, would that help this whole thing? If the single employee would contribute just a little bit more, but that's only how many employees?
35.
how many?
35.
Well, and so, yes, as, you know, like I take the single plan, I'm more than happy to contribute part of that. But it doesn't change the fact that a family plan costs 4 times the amount that a single plan costs, almost. And so even if the single person pays $25 into their plan a paycheck, the family is still receiving more than $1,100 in benefit more than the single person. And I think that that's been Monty's point. So I see both sides.
Doug, do you have anything else you'd like to say? I mean, we're still talking about, but I didn't know if you thought of anything or.
No, it's no, the answer is no.
It's obviously complicated. It's obviously a sensitive topic.
Yeah.
And I'll throw out there, it's not that it has to be 90 or 85. There's numbers in between those two. You know, like 87, not 85. The math only happens when we determine the rates. It's not
Right.
like that's an ongoing odd calculation.
What would it be if it was, and I know Mike, you probably can't answer this, maybe you can't. What would it be if it was 87%?
I can tell you it was 87.5%.
Okay,
There's $86 different right there, so take off $43, or you add $43 to the 25, or take $43 off. That would be what it is, so it'd be for a family, it'd be $68 a month on the family plan. It would be $76.38, it'd be $51 on the employee spouse versus the $13 increase, and 18 and 71.5, roughly $53 from the employee child. For an
Okay.
increase. That'd be if you split the difference.
Right.
Can't do the other math in my
No.
head, sorry.
And you said this was at 87.5%.
That would be 87, it'd be roughly 75, 643, be $68 on the family,
Okay.
let's say 30, 16, 75, 51 on the employee spouse and the employee child, then from 18 to 89, 140, be 57, 58 on the employee child.
It's a reasonable compromise. But
Yeah.
it's because our time is short for
Yeah.
this year. But I
Yeah.
do like the idea of giving employees options
Yes.
in the future to include if they want, they can opt out of certain pieces or deductibles.
Do you think, talking to our employees right here, do you think 87.5%, if what Mike said on the numbers wise, would,
What was that number for family again? If you
It was 68.
so instead of,
dollars a
a
month increase.
would that be reasonable?
$4 on the pay period is more or less irrelevant. I think that 90% of everybody won't even see that.
Okay.
And by the time we hit our next pay increase, they'll absorb it.
Okay. Doug, how do you feel about the 87.5%?
Sounds okay to me.
Okay.
Justin, did you have a different perspective?
No, I mean, I can only speak for myself. I don't know all my employees under me's financial situations. I could personally swing the $68. I think it's a great benefit. I personally wouldn't think twice about, I don't wanna pay $68 more.
Sure.
But I completely understand why, that if you see how much more the city, like if you see the breakdown of like the city's paying this much and now mine's only, it goes from $199 a month to $270 a month, $265. I think the benefit's still there for me. That's my personal opinion.
I agree.
Well, it looks like we have some give and take here.
Yeah.
And Monty, I know it's not that everything that you're wanting, but I don't think we're ever gonna come to a compromise. We're gonna spend, the next hour or 2 hours going over a few percentage points. And I think 87.5 is, this year, comparable is okay.
And I'm gonna add one more thing in. Keep in mind too that those premiums are coming out before taxes. So the net amount out of their paycheck isn't going to be that full $68. So that might help a little bit too.
I didn't know if you had
One
any.
more thought.
Sure.
If this was coming out of your personal checkbook, that you were going to stand at 90, it's 142,000 and the employees were gonna stand 12,000 of the increase, would you think the same thing? Just,
I don't even know what $142,000 is.
I mean, if 87% is 4-1, we'll go with it. I think it needs to be more.
Okay.
Go on a boat then.
To 87.5%.
Okay. All right. Any other discussions before I make the motion? Doug, do you have any last minute comment?
Nope, I'm ready.
So the motion
Will be 87.5%.
and going to the $6,000.
Yes, $6,000 deductible. Okay, I'd like to make a motion that we approve our health insurance renewal at a $6,000 deductible with a $1,000 Freedom Plan deductible, and where the employer cost, is it employee, or should I say?
The employer share is 87.5.
Okay, the employer's cost share is 87.5%.
Second.
It's been moved and seconded that we approve the health insurance renewal at $6,000 from Blue Cross and Blue Shield at a $6,000 deductible with a $1,000 Freedom Plan deductible with the employer cost share at 87.5%. Any other discussions? All those in favor, please say aye. Aye.
Aye.
Opposed?
No.
Passes 4-1. Okay. Thank you.
Thank you. And we'll work for next time and looking at a dual option, probably. Keep that on.
Thank you, Mike. Thank you, Brenda. We appreciate all your guys' hard work.
Thank you.
Okay, moving on to 6.3, consideration of the C-CLIP project. Mr. Jeff Shanline.
Thank you, Mr. Mayor. This is a request for both the bid and funding approval for the C-CLIP project number 76-U 255401. This is the US 54 and 281 project that has been talked about for the last 3 years. We have gone out to bid and have received back one bid from APAC Shears from Hutchinson. That bid is in the amount of $691,362.01. This is a 90% KDOT funded, 10% city funded project, with the city being responsible for 10%. That comes to $69,136.20. We are also responsible for 100% of the construction engineering yet to be paid. That is budgeted for $131,000. We have already covered, if I'm correct, and EBH is in the audience, we have already covered all of the 100% of the preliminary engineering, so that is paid. So that brings us to an approximate total of $200,136.20. This project is booked for May 2027. So this will come out of next year's budget, of which we do have both reserve budget in line item 683941 for $250,000, or budget for street tax fund number 18452-407 in $210,000, both of which are sufficient to cover the project. So it is my recommendation that we go with the bid and funding for APAC Shears in the amount of $691,362.01 for the C-CLIP project.
Any questions for Jeff?
I do.
Yes.
Does Venture not bid anything on stuff like this at a great bid?
We sent bids to, Amy,
Venture did pull the plans on this one.
they, what?
I believe they did pull the plans for this one.
They pulled,
We sent the plans to them for sure.
but they did not send bid back, correct?
They did not, APAC was
Correct.
the only bidder on it.
So we sent out, did we do Hefton Son also?
Yes.
Yes, so we sent out for multiple bids. APAC was just the only one that replied back.
That's why the costs are so damn high.
I will say, this is substantially lower than we predicted.
Oh. It's lower than the engineer predicted. Didn't they,
Yes.
a little bit higher? I forget what it was.
I believe Russ put this in as a bid package in the estimate of closer to 1.2. But that was his high-end estimate from different bids, so I was perfectly content with the bid that came in. So,
I'll make a motion that we approve the C-CLIP bid from APAC Shears in the amount of $691,362.01.
It's been moved and seconded that we approve the C-CLIP project from APAC Shears for a total of $691,362.01. Is there any other discussions? All those in favor, please say aye.
Aye.
Okay. Moving on to 6.4, consideration of alley bid on South Main. Mr. Shanline.
thank you again, Mr. Mayor. This is simply an alley replacement on the 400 block of East Main behind Westoff Plumbing. This will be 230 feet by 12 feet by a full 8-inch depth concrete replacement. That'll be a center gutter drainage like we've been replacing in most of the alleys.
The whole block, right?
Almost. There's approximately 30 feet on the north end that's already newly replaced. There's no reason to tear it out, so we're continuing from that seam south to include the driveway pour, or the approach pour. We sent out for 7 bids on this, receiving back 4 from Arnsdorf Construction in the amount of $26,082. Mansell Construction for $29,895. Orozco Concrete in the amount of $25,000 even. And Smiley Concrete in the amount of $25,300. I have contacted both Orozco and Smiley Concrete to see what a completion date would be. Orozco Concrete told me that they would be project complete by the end of September.
This year?
This year, yes, ma'am. Smiley Concrete told me that they had a completion date of inside of 30 days. So with that, I am recommending that we use the bid of Smiley Concrete for the additional $300, the amount of $25,300 to be completed inside of 30 days. And that will come out of street fund tax 18,452,407, of which currently we budget $210,000, and to date, according to Chair, we have yet to use.
So what happens if they can't get it done in 30 days?
I haven't crossed that bridge yet, but I don't know Smiley to go back on his word. But I do have it by text message that he said 30 days. It's not in the contract or the bid sheet, but I did contact them both to ask what their time on target and completion time was, so.
So we didn't have the option to go with the even higher bid with that caveat of time.
I had not contacted any of the higher bids. I have only talked to Orozco and Smiley, being as they were low bid.
Okay.
I'm okay with the $300
Okay.
to speed it along.
Okay.
Okay, I'd make a motion that we accept the Smiley Concrete bid of $25,300 for the alley replacement.
Second.
It's been moved and seconded that we approve the alley bid on South Main with Smiley Concrete for the total of $25,300. Any other discussions? All those in favor, please say aye. Aye. Okay. We are tabling 6.5 till August the 17th. So with that, we'll move on to 6.6, consideration of shipping container storage. Mr. Crouch.
Thank you, Mayor. So this is gonna be a 40-foot shipping container, simple shipping containers out of Wichita. If you're ever heading into Wichita on the north side of the road, right before you get to the Ford dealership, you'll see all the shipping containers. That's their location. They fabricate them all there. So this is ivory in color. It'll get close to matching the buildings, the bathroom, and the press box that is out there. It'll come insulated floor, ceilings, walls. It'll be framed out. It'll have electrical ran through it. 2 steel walk-in doors, 2 windows, partition wall down the middle, a mini split for heat and air with 2 indoor heads. The purpose of it is to have half of it for concessions and half of it for our umpire room. So currently, every tournament we had this summer, we played a full slate of games there on both days, Saturday and Sunday. So we'd average about 12 so games on Angood and about 10 games on Dickerson for the weekend. And then 6 weekends. So what happens is we ask our umpires to umpire 5 or 6 games a day. And we say, hey, you get to change in the parking lot. There's nowhere for you to change or cool off between games. We don't have a concession stand. We try to have a little makeshift chips and drinks, but we bring them food, but then it's too early or it's too late. So they have to eat cold food. It's not very good treatment for us, for our umpires. And then also on the concession side of things, we don't have a concession for the people that are out there. So it's 2 fields, green's 4 fields. So it's not quite as many people, but if you've ever drove through there on tournament weekend, it's packed. There's not a parking, there's cars everywhere. There's a lot of people. And that's our number one complaint that we get, is that we don't have a concessions down there. It's a great problem for us to have, is that we're having to use those fields every tournament. And so that's why we're trying to make improvements to Lemon Park, the facilities there for our tournaments. And it's also gonna be beneficial for Skyline. They play their baseball games there. PCC plays their softball games at Angood. So their umpires will be able to use this, store their stuff, change between games, be in the air condition. And then we'll also be able to work something out for them to use the concession, one of our workers, and they could have some volunteers to help on their game days as well. So that's the plan for this. The fund will come from Fund 52, which is our rec trust fund, which is where all of our tournament proceeds go into. So you can see on the form, the amount requested is $27,415. And then the total amount in that fund, when I was emailing Tara a couple weeks ago, was about $183,000 in there. So that would leave about 155. We've had some other expenses out of there. It's a little lower than that now, but still plenty of money in that account. And that's where it would come from, so.
And Justin's processes that he's implemented over the last year has brought in well more than that amount of money.
And I was about to say, Justin, I think, you know, you've had the rec department over for a year now, and I mean, the last months alone, I mean, you've grown our tournaments large. And
Yeah, so the budget authority for that account, Tara, correct me if I'm wrong, was about $80,000, $85,000. So the projection for that account was to have about that much, it got up to $183,000. So we were about $100,000 over projection. Is that somewhere in there, Tara? Is that right?
Yeah, we had to start budgeting for that fund for the first time last year, so it was kind of a
So
guess.
Yeah.
And
it did way better than projections have done, and there was a lot more money in there. So now the budgeting has to be a little different on that account, which is a good problem to have. But I'd like to spend a little bit of money. That's what the cages were paid from. So there was some trust money in there, and then that's also a tournament account that they're working on now. And then this out there will help invest some of that money back into our tournaments to keep growing them.
So, couple questions.
Yep.
Where, it said where this would be located, but
Yep.
it didn't
So
sink in, cause I was thinking Green Sports
no,
Complex.
this is at Lemon Park. So
Right.
Ann Good's the smaller field, the 200-foot field. Dickerson's the big field. And then the bathroom's right in the middle.
Yeah.
In the parking lot. And then there's a batting cage for Ann Good that runs like this. And here's the batting for the bathroom. It's gonna run the same direction as the batting cage on Ann Good. We'll have some spacing between the cage and then between the parking lot. So the concession window will face out towards the parking lot. But that's the general area. Power's gonna be easy to get to. According to Jamie, there's a pedestal right there. And then I talked to Jeff about getting water over to it for like a sink, and the bathroom's right there. He said it wouldn't be much work to get a water line over to it as well. So.
So you're gonna make a mound to set it on?
Correct. We're gonna have to build it up with gravel or crushed concrete and then pour the footers, just some concrete footers on all four corners and then two in the middle. And to set it on, but they'll deliver it and everything. It'll be ready to go as soon as they drop it off and they put power to it and water.
So that's my question, what Monty just touched on. Knowing what I know about Lemons Park, it's in a floodplain. Will this affect, as Lowell looked at this, will this affect any part of our floodplain at all?
I mean, I don't know the answer to that.
When we did that bathroom,
Mhm.
it was a hell of a raise. And I think they've actually raised it, that floodplain even more from when that was built.
Yeah, I'm not sure on exactly how, if we'd have to build it up or how far. I know we have to build it up some, because it's where the cages are in the bathroom. I don't know if they were planning to build it as high as the bathroom. That's a pretty good hill.
Yeah.
You'll have to.
I would just ask
Yeah, we can check
that
with
you
Lowell.
look at that, just in case, because we may be in violation of that.
Okay,
It's just something, let's just be cautious about it rather
we can
than.
look, we'll check and
put it
see
on there.
what foot elevation it needs to be at, to get it. I knew we were gonna build it up. I didn't think we were gonna have to build it that high, but we can check and see what that
Sure,
elevation
sure.
is needed.
Has the bathrooms ever flooded?
The new bathrooms?
New
No,
bathrooms,
no, I believe they're on at least a 36-inch hill, if not slightly more than that. So they have never had water in them.
Yeah, I didn't think so.
The other thing is, are we permanently attaching?
No, well, I don't know what
Sort
the
of.
power would be, how that would be, if that considered permanently attaching.
There may be some question on the that doesn't mean practically that there's not a, if we're in the floodplain that we have to raise, but there gets to be if there's a temporary storage situation and you're in the floodplain, you may not have the same level of requirements to build up. Okay, but at the same time, you're looking at it practically and what you can do and what maybe you should do are two different things.
But I heard the words
Yes,
footing and.
Yeah,
and
I heard the
that
same
kind of
words.
threw me in that.
yeah, when you
It'll
hear
sit on
footing,
top
it's
of the
like-
concrete footing, the box will.
I just asked that you just look at it.
No, we will, I'll check with Lola and see exactly what the requirements are for us.
So is it up to us to build that mound and they're just gonna set it on there?
Correct.
Okay,
Yeah,
so
we'll get the prep work done to build it to up to whatever it needs in a flat surface, someone to set it on, they'll come and deliver it and set it on our footings on the pad.
So then we'll have a concrete contractor come in and do the footings where you set it, or is that something that
We can do the footings ourselves, or if it's something that we can get a really good, that's cheaper for a contractor to come in and do. But the footings is, I mean, we did them out at the fire department training center, we dug the holes and, I mean, obviously had to get the concrete company to come dump the concrete, but we did them ourselves. Footings are pretty simple for something like that. But
and I don't think on those containers that it has to be a complete one around it.
no, we
Because-
just poured footings in the corner and then two in the middle and then each corner, yeah.
I like the price.
Yeah.
Yeah, it's way cheaper than we can even remotely come close to building something out there. So it'll match and I think it'll be great for us, so.
Perfect. Doug, do you have any questions?
No, I have no questions. I'm glad you addressed that floodplain issue.
Okay.
I'd make a motion that we approve the purchase of the building from Simple Shipping Containers for a price of $27,415.
Second.
It's been moved and seconded that we approve of the purchase of shipping container storage for Lemons Park for a total of $27,415 from Simple Shipping Containers. Any other discussion? All those in favor, please say aye. Aye.
All right.
All right, thank you.
All righty. 6.7, consideration of the conduit for cat generators. Mr. Huber.
Thank you, Your Honor. We're finally here getting some parts ordered for our cat project. Got a list from our electrical engineer on the conduit that we'll need for the whole project, connectors, elbows, and such to get us started. I sent out 2 bids to Stanion Electric and Border States. They both sent them back in the time that we asked for. And last week when I was kind of going over both quotes, Border States was like $7,000 under Stanion's. Yeah, and that kind of caught my eye, so I started looking into it a little further. And then I realized that they quoted the wrong elbows on everything, so I sent them a whole spec sheet on what size they needed to be, and they failed and didn't send the right ones, so he did send me another updated version. I said, well, it's too late at that point, and they were, at that point even, they were both comparable within a few $100s, and I said, that's fine. I told him, I said, well, we're gonna throw you out just for not quoting the correct materials, and I'll just go with Stanion's this time, and then, of course, with their 5% or in town 5%, Stanion's would have been it anyways, so. Long story, but I would recommend Stanion's for $32,599.40. That did include tax on this project. As of right now, I am gonna pull the funds from capital improvements out of production. And then when our bond is finalized here in the next month, then we'll reimburse back into that when we use the bond money. So I'm trying a lot of small parts. We're trying to get just out of our normal day budgets. Stuff like this, wire, concrete, all that's gonna have to come out of that.
And where was that bid from that you're?
Stanion Electric.
I thought
sorry.
that's what you said, but
Yeah.
I wasn't sure.
And the other thing was I can get all the conduit within the next 2 weeks. Border States was out like 8 weeks, so we're kind of on a crunch right now to get things going. As soon as this is approved, we'll get it ordered. Hopefully in this next week, we'll get it in and start laying some conduit in the ground, so.
I'll make a motion that we approve Stanion's Wholesale Electric for the contract for the, it would be the conduit for the CAT generators in the amount of $32,599.40.
Second that.
It's been moved and seconded that we approve the purchase of the conduit for the CAT generators from Stanion Electric for the total of $32,599.40. Any other discussions? All those in favor, please say aye. Aye. All right, and last, 6.8, consideration of the garage door expansion. Chief Hoffman.
Thank you, Mayor. Yeah, we have currently our engine 2 is sitting behind Rescue 5. So we need to move Rescue 5 over to the North Bay. And that North Bay is just not quite big enough to have that truck move in there. We're constantly shuffling trucks back and forth. So past probably a year or so, we've looked at different contractors. I did get a hold of Wichita Coring, which is the ones that cut the wall over at Woody's. Finally able to get a hold of them. They were able to get us a quote for cutting the door. And he was in the process of trying to find a mason for us and never could find a mason, which we did find a mason out of Hutch, which was Matt Yoder. We'll do the masonry work, and then we also had to have Cheney Door requote the door to put the bigger door in and replace it. So all of that should have been in the packet. That total amount for that was about $15,870. And once we get that approval, we'll be looking at trying to get all those three together. We did have a meeting with all three of them at the fire station. They looked it over and said that everything would work with what they were looking at. So finally able just to get somebody together to do that for us.
I'd make a motion that we approve the amount requested of $15,870 for Cheney Door, Wichita Coring, and Gilder Masonry to do the fire station door.
Second.
It's been moved and seconded that we approve the purchase of the North Bay door opening from Cheney Door, Wichita Coring and Cutting, and Yoder Masonry for the total of $15,870. Any other discussions? All those in favor, please say aye.
Aye.
Okay. All right, moving on now to open public comment. City matters only 3-minute time limit. The public's allowed to speak on issues or items not scheduled for discussion on the agenda. Comments should be limited to issues and items germane to the business of the governing body. To protect the privacy interests of individual employees and to avoid discussion of matters not appropriate for open session, comments regarding the hiring, discipline, performance, conduct, investigation, resignation, termination, other employment statuses of any specific non-elected city employee will not be permitted during open comment. Speakers may address general city policies, practices, department operations, or service concerns, but not individual personnel matters. The commission will not discuss or debate these items, nor will the commission make decisions on items presented during this time. Members of the public will be limited to 3 minutes for comments. So is there anyone in the audience that would like to speak to the commission? Okay.
I just wanted to introduce myself. I'm Alan Alberts from Cunningham, and I'm running for the Kansas House of Representatives, District 114. About a third of the population of Pratt would be in my district. I farmed and ranched for 30 years, and I taught school for 15 years. I taught at Skyline for 8 years, history and math, and then after that at Sharon, special ed school down at Sharon. My 4 key issues are agriculture, education, water issues, and the joy. We need to get back to being joyful about we're Kansans and Americans, and all I see is anger and hate. So I just want to introduce myself, and I'll leave some flyers. If mostly the southeast quadrant is my part, and then the north of the northeast part. So, thank you very much.
Thank you, and best of luck to you in your election.
Thank you.
All right, does anyone else like to speak? Terry?
Not here to talk about politics or anything.
Okay.
Terry Williamson. I'm a business owner in Pratt. I reside in the city and Pratt County. I've talked to a few of you about the golf cart. issue here in Pratt. The state statute reads about, well, I can read it word for word, but anyway, it talks about golf carts on city streets and that they have to have, turn signals and headlights, and now the city's implemented having tags on them and insurance. What my question is the state statute reads that it says in there that they can be operated on city and public roadways, comma. And it further states that they can be after sunrise, not sunset, operated on city streets if they have a slow-moving vehicle emblem and headlights. And so my question is if we have to have headlights, mirrors, turn signals, registration, tags, insurance, basically everything that a motor vehicle has, why are we limited to not driving those after sunset? So, our statute, sorry.
I'll tell you, I mean, when we, there was a time where we didn't allow ATVs or golf carts on city roads. Kyle, your friends owned the gallery during those meetings.
Yeah, yes, they came to us about that and they said, I'm friends with Kyle, I live down the street from Kyle.
But what happened was, so we took the state statute and the chief of police at the time marked it up. He really didn't want them on the street at all. And then he drew a hard line after dark. He didn't want any of them on the streets no matter what. And so he was the one who was in charge of enforcing traffic ordinances. The commission deferred to his wishes. We have had a change in leadership at the police department, and so that is really would be an appropriate discussion to have with the current leadership there to see if that whether or not it is still the opinion of the leadership of the administration at the police department that they don't want the golf carts and ATVs on the road after dark. I don't know that I haven't had a lengthy discussion with Robert or Ken or any police officers about that. But that's the reason why it was written that way.
Yeah.
It was in deference to the chief of police.
Several of us have talked about this.
Yeah.
And I'm not saying, and maybe there needs to be like a curfew on it, I'm not gonna be out there past midnight, cause.
I don't know, Terry, I think you can.
But there's sometimes, most of you know that I take care of the laundromat in town, and it's easier for me just to hit the garage door button, bounce out of my house. I live on the same street that the laundromat's on, and I just buzz down there. Somebody, usually their clothes are locked in the machine, or if the machine took one of their quarters or whatever, and here I am at midnight or sometimes 1 o'clock in the morning that it stole their money or whatever, and so I just buzz down there on that, and it saves me from, starting my diesel pickup and run that, and it's quicker, the golf cart's quicker, and so, and many a times, also most of you know that I have the flower shop, many times I'll mow, especially when it's hot like this, I'll start mowing when it's, 30 minutes before sunset, and that's how I haul my mower is back and forth is on that golf cart, cause it's not high like my pickup, and so it'll be an hour after dark before I've got everything blowed and weed-eated and everything, so I'm loading my mower up and trying not to get a ticket between the flower shop and the house. No, he's never stopped me for that, but I did get, what brought this on is I read the state statutes and I did get everything registered and tagged, and I got stopped one night on the way to the laundromat. And it was for a rental car that somebody needed, and so I was just as shocked as they, Terry, what are you what are you doing breaking the law? And I was like, I didn't even know I was breaking a law. So that's my 2 cents.
Well, I think what I would recommend, Terry, is probably sitting down with Robert sometime.
And I have actually.
Okay.
Yeah.
So is it the STO, is that what we're talking about, the standard traffic ordinance?
It is a standard traffic ordinance. I would say that this is a question that's been going on since the year 2008 over what will happen with sunrise and sunset. And so if you look at the first ordinances that came down, It was limited to sunrise and sunset. You had to put a slow moving vehicle sign like you would on the back of a combine or a tractor on it. And then there were questions about what lights would come up. This is I think of a golf cart that I saw in the town of Easton, Kansas, where they had a slow moving vehicle placard on there, and it was a man that looked like he had a one-legged dog running beside it. You know, towns that are there's not a lot of activity in Easton, you know, and so there's regulations, there's a lot of flexibility in the state of Kansas regarding that. Here we have 2 US highways that intersect. And so there's different provisions that relate to, 3, sorry. But, you know, we have the intersection of 3 US highways. There's different provisions for towns and cities that have larger traffic areas, okay? And so that's where we see a lot of the lights that come in. That being said, you know, these vehicles require more than they did 20 years ago. It is the STO that you can look to amend, but I can say that it's consistent with other cities that have this much highway traffic to have some restrictions on the timing. And it's primarily not for people that are like you that are using in good working order the golf cart, but it is, these golf carts don't really have seat belts that support child safety seats. Okay, for night,
That's not true though.
sometimes they do, sometimes they don't.
Yeah, our,
Right, but like,
mine has 4 seatbelts on it.
yeah, I'm not saying that they don't all.
Right,
Okay,
yeah.
but I'm saying that there's sometimes a difference, okay? And there's a lot of transition vehicles that didn't exist 20 years ago. You know, what was a Polaris 20 years ago versus now, you know, what was a Gator, right? But the problem is that, again, it's not for vehicles that are fully developed, but what if I wanna take my 25-year-old E-Z-GO electric cart onto the street and I do the bare minimum, you know, what do we have? So there's a lot of issues that go into that versus nighttime, day, who sets on what, and so I think it's an evolving conversation. But if you pull out those provisions of the STO, which we can amend, you'd wanna look at additional safety measures for what nighttime use looks like and who could be on it at night. Because if you just open it up blanketly, then you may have issues that are unattended. So that's what I've seen elsewhere, is that if you're gonna use them at night, there's more restrictions if they are used after sunset than there would otherwise be.
Hey, Austin, could you send maybe me, and I can forward it to Robert, or just send it to Robert, some ordinances from other cities
Sure.
that have a blend of those, you know, that allow some nighttime use but have maybe further restrictions?
Yeah, I'll look into that. I'll find some. It's been a hot minute since I've looked at this, but I've looked at it. It usually comes up every once in a while. So yeah, happy to send that over. We'll look into it and see what we can get.
The 3 biggest crowds that we've had in our gallery, other than budgets, are pit bulls, chickens, and ATVs in the last 10 years.
Gina, that was exactly what I was gonna say. Whenever I hear about pit bulls, roosters, okay, also feral cats.
Yeah, we had that
Talked
one.
about that today.
Oh yeah, no, these are the things that when I see them on the agenda, I just, oh man. I did have, on a funny note, I didn't make anything that was, this is my sense of humor. But granted, I've been to 1,000 meetings now, so you'll have to forgive me for this, somewhere in there. I left a 2-year-long conversation regarding trap neuter release versus trap and euthanasia. And I have absolutely no skin in the game, literally. But as I pulled out, they decided to go with trap and euthanasia to keep that for the time being before they evolved to trap, neuter, and release. Regardless, as I pulled out, in the center of the street was a feral cat staring me down at night. And literally, I was in a standoff. I'm like, I didn't do it. You know, this wasn't my decision. So there you have it.
You guys, Robert, you guys can figure that out. All right.
So Terry, I hope we kind of answered your question there. We'll kind of look into more of it, I think, so.
Thank you.
Yes. Tammy.
Hi, Tammy Coleman. I had a citizen approach me earlier this week about advertising signs that are at the corners and the right-of-ways and along the pathways of Lemon Park. And I'm not talking about political signs. I've seen them too and wondered why we have so many signs advertising different electrical services and signs for garage sales that are on, you know, the posts that are along the highway, and for different vendor events, craft shows, things that, and they stay out too long, but they were really not very happy about the ones that are in the parks.
So it's a constitutional question. First Amendment issues, you know, have any regulations that the commission were to pass have to be content neutral. We can regulate the setback lines, we can regulate the size of the signs, but we can't look at the content and regulate based on the content. Austin, do you have anything?
But they can be on public land.
It's kind of a hot mess, so
Like
I'll tell you why, cause it's KSA 252711 and this came down in 2015 as a law, alright? And so it says, particularly around election periods, that if you have, you can't regulate them on private property or unpaved right-of-way for city streets or county roads on private property. But it says, no city or county shall regulate or prohibit the placement or the number of political signs. But that is an unconstitutional law, and that came down right after this US Supreme Court came down with a thing called Reed versus Town of Gilbert, Arizona, where they were talking about the placement of signs that advertised for like church events, right? And they said, you know, I think the Supreme Court referenced something about like realtors, you know, hey, we pound the signs out there to show we're open houses, and also you've got church signs, and so what are we doing? Can we regulate against content? And then the Supreme Court said no. So everybody changed their sign code, and I've done it a few times, it's just a hot mess. So like around elections, it gets a little dicey.
Well, I'm not even gonna go there with elections,
Yeah.
okay? But in particular, advertising signs, advertising businesses in town on the pathways in Lemon Park where people walk. That's, I just wanted to know, and you don't have to answer the question today, but
It's like a traditional or a hybrid traditional public forum. And so there's some ability to put signs or billets out there. We can try to look at some of it, but again, it's like when I say hot mess, it is a hot mess. Like there's 3 areas of law that, we're touching on everything tonight. Like these are one of the 3 areas.
all right, well, thank you.
Okay, anyone else from the audience that'd like to speak? Amy?
Nope.
Okay, give me that look like you were about to. Okay, all right, with that being said, we'll move on from open public comment, move to reports. City Manager, Ms. Goff.
Thank you. I've been working on several of the things that we're talking about now, and that we talked about this evening. Some of the extra things have been Jeff, Jamie, and I attended a seminar conference last week for Wednesday and half of Thursday on the topic of data centers. KMU was putting on the discussion. We wanted to have more information so that we were more fully informed on the topic, and I'll let Jeff and Jamie pass along during their sessions, you know, what they walked away with. I will tell you that I walked away with the knowledge that what is out there in, you know, the angry discord is largely misinformed of the different the different possibilities with data centers. So there's a lot of misinformation that was corrected, and it was interesting to see so many of our respected colleagues. In fact, at that seminar, it was in Topeka, and I was highly impressed with the number of legislators, state legislators who attended. There were a number of senators and representatives from the state houses that were there to learn more as well. I've been having some discussions with airport authority members just since the last meeting where we had new members appointed, and it sounds like their last meeting went relatively well. Mr. Lunt wasn't able to attend that one because it was too short notice, but Terry was there and the advisors were there, and they thought that things will move in a positive direction, so I was pleased to hear that. We did hire a new IT director, Sean Toll, who's operating our video machinery tonight, so welcome aboard, Sean. Sean is going to be, his first full-time actual day is not until August the 10th. He has a pre-scheduled trip out of the country, and so he's working on an hourly basis for us now, which we appreciate very much. The municipal court software transition is progressing. They love the new software very, very much. It was interestingly much less expensive than the old software, much more user-friendly. And so they can't switch over all of the data and information fast enough.
And our new clerk's doing great there too.
She is. I stopped in and saw her today. And she's like, I'm learning. It's
Oh, good.
going, yep. And
Good.
she's incredibly bright and she is doing a good job. Jamie and I have been in a number of discussions with Stiefel regarding the bond issue for the utility bonds for the new generators. Jamie loves those meetings and he especially loves the preparation times for those. He wants to do this again next year. No, I'm kidding. What day is Stiefel gonna be here? Is it the next meeting, August 3rd?
6th.
Is that Monday? The third?
Yeah.
Third's a Monday, but I thought they said the oh no, they have us signing it on the
Yeah,
6th.
you're gonna have to sign. You
Yeah.
and her sign it on the 6th.
I just have to come in and sign something, right?
Okay.
But I'll answer any questions.
Any questions for Regina?
No.
Okay. Thank you, ma'am. All right, Public Works, Mr. Shanline.
Thank you, Mr. Mayor. Yes, as Regina stated, we were in Topeka most of last week. I thought it was a very productive seminar. We sat directly adjacent to the representatives from Barber County, so we got good input from them, both positive and negative aspects of it. I took more away from it to the positive, being as a tax incentive basis for the city county than the negative aspects. I believe I was being overly positive for that, which some can speak is not to my nature. But I was optimistic, so I was open to the positive sides of it. Being with that, I played all day today as catch-up, so I don't really have a lot to report. I was in contact with CR Services. They are getting ready to, if not already have done, mowed the water treatment area again up on Walnut Street. It's just a nuisance and overgrown, and they have the equipment and can maintain that for us at a reasonable fee, and we don't tear up our own equipment, being as there's lots of debris and things underneath there. We completed Mike, did we complete the survey for well 6?
Not yet.
Not yet. We got permission to do a survey for the relocation of well 6 from the surrounding residents. That survey is yet to be done, but that will give us the next step in that process to figure out whether or not we can move well 6. Sanitary sewer line at the point is getting ready to be fused together still this week by X Services. Wastewater department was out there doing some work, making those lines more maneuverable since they're very rigid, so that X Service can get in there and do those fusions on that force main. All departments are maintaining the best they can in these incredibly high heats. Yard work, weed eating, all of that is being done continuously until the highest temperatures of the day, and then everybody goes back to their shop and maintains equipment and tries to be able to be available for the next day. So everybody's starting early and getting as much done as they can by noon, 1 o'clock, somewhere in there, and then going back to maintain equipment. But and that's pretty typical for this time of year, unless there's a significant need out in the field, so. But other than that, really, that's all I have until next week when I'm caught up, and then we'll have a better report.
Well, I will say, who was that company we used to clean up all that graffiti off?
Private owned company, his name is Garrett Yankst, maybe? Did a fantastic job.
I drove by it once it was all said and done, and I'll say it looks like.
You would have to get on your hands and knees to see if it was ever graffitied. So, and we kept his card.
Yeah,
So,
good. Well, I thought he did an excellent job, and I appreciate all he did to get that all cleaned up.
yeah, I would agree.
Do we have a camera on that area still?
There is no surveillance or Wi-Fi in 6th Street Park.
It's called Elite Surface Solutions.
So I have seen graffiti down in the drainage ditches over,
Correct, they're on 9th Street.
yeah.
Yeah.
That would be nice to eliminate that, so that's not something that becomes a competition.
I 100% agree. We were more concerned that it'd be a competition to somebody to re-tag that slab in 6th Street since it just got newly cleaned. But yes, as his availability comes available, or we can get our own pressure washer in there, somehow his had significantly more pressure than whatever we had.
His was hot water.
It was hot water
Yes,
pressure.
he had a
yeah,
trailer
so-
with it was hot water, so
Yeah,
that's how,
yeah.
and a chemical.
But yes, I do agree there, and the drainage ditches, the graffiti is unsightly, so.
Just to interject, I found some graffiti underneath the Maple Street Bridge and called it into the non-emergency police number. Is that the proper route or,
I can't see why it wouldn't be, yeah.
okay, cause somebody had dumped an old computer monitor down there and that's what caught my attention and then I saw the graffiti underneath the bridge.
I would imagine every bridge in town, if you walked underneath them, there'll be some tagging of some sort underneath all of them, but the public eye sees the parks a lot more than
Yes.
underneath the bridges, but
Yes.
all of them are of concern for sure.
Any other questions for Jeff?
Nope.
Okay, perfect. Thank you, sir. All right, building inspector, Mr. Walker.
Thank you. Been at Walmart, did a mechanical refrigeration inspection there. They're pretty much done with their stuff now. They're gonna start moving stuff in. Last time I was out there, they were having some issues with the doors, but I'm sure they have that resolved by now. Been to Love's for some electrical, inspections there. Still ongoing water issues from our flood that we had with all the rain. 3 concrete inspections. Been dealing with some sinkholes around town, mainly in our alleys. I believe it's from where they're boring. Had a couple fence inspections. Had a contractor from out of town dump some concrete in one of our alleys. We had to get them back to clean it up. Electrical inspection at the ATM there at First and Champa. 2 garage inspections and just been doing some mowing. And the police department, got 190 calls, 44 traffic stops, 5 accidents, 2 domestics, 6 welfare checks, 8 animal nuisance calls, and 15 BINs.
Any questions about building inspector or police department?
Nope.
Okay, thank you, chief. All right, electrical department, Mr. Huber.
So I'll just continue on the data center. I could talk to you guys for an hour and a half on it. There was a lot of state representatives there. Top brass of KDHE, Kansas Gas, Evergy, every utility in the state was there representing it. There was a lot. There was a lot to take in. And the utilities are like covering themselves with contracts they're putting on place, and it wasn't just data centers, it was large load in general. They brought in representatives from Oklahoma that already have data centers, and their mayors talked about the good and the bad that they brought to their cities, and it was interesting. It was an eye opener, cause I went into it not knowing what are we gonna really hear, but there was, I don't know, 300, 400 people there maybe, I don't know.
I agree, there's, yeah.
I was expecting 50, and I was kind of blown away there, but the funny part was, while we were there was protesters out front, so. And I missed all that, I guess, I didn't even see it till I
We
watched the
walked
news.
past him. I said hello, good morning to them, and Jamie didn't even see him.
No, so anyways, it was interesting to go to. Moving on, we did run Unit 5, that's our steam turbine last week. We did a capacity test on it, that's our yearly one, and we did really well this time. We put out a little more than we have for the last 5 or 6 years, so I was really pleased with that and the outcome.
How does that happen, Jamie?
Everything worked at all
Poor
at once.
management before.
I didn't hear that.
He said poor management before,
Poor management, yeah.
because
Okay.
he's the prior managers.
It's about time that everything functioned all at one time, the way it's supposed to. Last year we had some pumps fail and caused us to not be able to run, but yeah, it was. The knowledge for that unit, for people running it, is slipping away really fast, so getting the cats coming and getting them installed is gonna be a blessing, so. Anyways, so that went really well. Speaking of the cats, we started this week working on them. I got my line crews over there and started drawing out where all our conduits need to be and what needs to be punched through what hole. And I have a contractor coming in Thursday to drill some holes, about 19 holes actually, in our pole boxes in the control house, in that footing area where the cats will sit. They're gonna come in Thursday and get that done for me. With the approval of the conduit, we'll get that going. I met with one contractor for concrete this afternoon, another one tomorrow. And we've got to get this ball rolling. So at the next meeting, I hope to have a bid for that, for the concrete part. There's a lot that's gotta be going on. The concrete's gotta set up for around 30 days, so our time frame, we're looking at the end of October or November, and it's coming fast, so we're gonna be getting a lot going on over there. So I've been taking pictures before we started of what it did look like, and as we develop, we'll keep taking pictures, so. Starting tonight,